Approximately 1 in every 17 people may have chronic kidney disease. Of those, some will go on to develop renal failure, requiring long-term dialysis treatment or a kidney transplant. Although renal failure is relatively rare, treatment with dialysis or transplantation is very expensive, both financially and personally, and in many cases even a transplant is not a cure. We believe that we can improve the diagnosis, treatment and understanding of kidney disease and make the lives of thousands of people in the UK better.
In 1990, I went for a pre-employment medical for a job that I was going to go for, and I was told that, did I know I was losing protein at 40 times the average daily rate? Well, that was a complete shock to me, and when I asked what that meant, they came up with this wonderful line that if you lose protein, they're the biggest molecules, so it basically meant I had holes in my kidneys. I was in my early 30s. I felt completely fine, never suspected anything was wrong at all. I remember sort of being told and sort of not being able to sleep and being sort of, absolutely shocked and quite tearful. It was an extremely unsettling time and very difficult to cope with. Something that people possibly need to be aware of is that often you can look really well and be in end-stage kidney failure. If I didn't know through my blood tests and my visits to the consultant how ill I was, I wouldn't actually realise. I would just think that I was getting older, I was getting a bit more tired, certain things were falling off through age. I fell under the care of Dr. Marsh. He told me that the good news was he actually knew what was wrong, and the bad news was there was no known cure. From then onwards, I knew that I was on a slippery slope, basically with a sort of level of decline every year, of losing between 3 and 4 points of kidney function each year, to a point where I would have to either be on dialysis or have a transplant, or probably have both. Personally, the illness I have will start up in a new kidney. It's carried in my blood, so I know that if I have my transplant, it's not a cure for life. It's maybe 5-6 years, and then the disease will have got rid of the new kidney. So I know that it's buying me time in a way, and that I hope that when I've done that, the advances in dialysis and everything will be that much greater, and it'll be that much easier to live on dialysis. You always end up going through, the very smart, beautiful buildings down to the one prefab post-wall building at the end of the site, and that's going to be the kidney unit. And you go in, and it's a real shock, and you see people in all sorts of states, and you can't imagine that that's, could be you. And the thing that's amazing is the people and the staff. In all the hospitals I've been to, the staff and the doctors and the nurses are absolutely wonderful. And kidney disease is not like breaking a leg. It's not something you'll go and get fixed and then you'll go skipping away. From the day you have your diagnosis, it's with you for life. And there isn't a day that doesn't go by when you aren't thinking about it. Your team around you and your nurses and your doctors become like a family to you, really, because you rely on them and you trust them and you ask them for advice. And that's where a lot of your personal attitude and positiveness comes from, is knowing that you've got those people there. If you didn't have that support team, I'm sure it would be much harder to be that positive about what was facing you, really.
Kidney disease is a huge challenge for the NHS because a lot of people who have it don't realise they do. The more you look for it, the more you realise it's affected a fair amount of people, and indeed, depending on how you classify kidney disease, close to 5% of the population may have it. Now, when you think about 60 million people in the UK, that's a fairly large number of people, a lot of who don't know they've got the problem. Another reason why it's a major challenge is, for conditions where you can get in early and treat, you have the chance of a cure. For conditions which are detected late, you've probably lost the chance of curing, but you're now into long-term treatment, and treating kidney disease isn't cheap. With regard to kidney disease, some of the most common causes relate to people with cardiovascular problems. Very often the people who have these conditions also have other conditions such as a history of heart attacks, poor circulation going to the legs. But another common group of people who tend to be affected are people with diabetes, because diabetes on its own affects the cardiovascular system, but also patients with diabetes tend also to have things like angina, probably poor circulation to the legs, and the kidney gets caught up in this. So in the UK, at least at the moment, between 30 and 50% of people who have chronic kidney disease have either diabetes or some other form of vascular disease. Not many people are aware of kidney disease in itself, but also the potential causes of kidney disease. And I think that is a big issue with regards to people maybe avoiding activities which could cause harm, or realizing when they've been exposed to it and then finding help. You can either give specific treatment. For instance, the patient's got an infection, so you treat that infection and expect the kidneys to improve as the patient improves. Or if you haven't found a specific cause, and this is the case in most of the patients, you give what's called supportive therapy. You cannot cure the condition, but you can make the symptoms better. Most of the population with kidney disease whose kidneys have failed to the point of needing help will be on dialysis of one form or another. Dialysis is seen as supportive therapy. A kidney transplant is much more than just supportive in that in some cases it is curative, but you probably have heard of people who've needed more than one kidney transplant, so if it was the answer, you wouldn't necessarily have had people needing further transplants. So you could also see it in some way as the best form of supportive therapy that we have. One of the other practical things people have to deal with is going on holiday, where before all you would have thought about is which destination should I go to and how much might it cost. You now have to add to that the realization, I will also need dialysis. Is there a dialysis unit close by? And that's one of the reasons why I think a fair amount of people on regular dialysis, hemodialysis at least, probably just don't book a holiday. The renal unit in St. Helier Hospital has been functioning since about the late 60s, early 70s, so it's one of the older renal units in the country. It's a large unit in that its catchment area, the people it serves, are close to between 1.5 and 2 million. You get to know the patients over a long period, you develop professional relationships with them, and this often leads therefore to you having a motivated group of patients who are able to say, I want to do something to help people with kidney disease. And when you start looking like that, you get the benefits of not just the medical and nursing profession, but people who have been affected by it and who bring a different perspective. And this is how we're then able to get ventures rather like the Southwest Thames Kidney Fund, which is developed at St. Helier, a beacon, if you like, for what can happen when doctors, nurses, and patients come to work together to tackle a problem. Here at St. Helier, the Southwest Thames Kidney Fund has set up the Institute of Renal Research. The hope is that in due course, the profile will be raised enough and hopefully we can begin to talk in terms of cure rather than hopelessness for kidney disease. One of the people who was very instrumental in helping to develop the Kidney Research Institute was a consultant kidney doctor called Michael Bending, and in partnership with another gentleman, Richard Salmons, and a few other people, they brought up a huge fundraising effort.